Our healthcare system is on the brink of a total meltdown. We spend almost $9,000 per man, woman, and child each year, which totals out to be $3.8 trillion annually. We simply cannot sustain this any longer. According to the World Healthcare Organization, our health continues to deteriorate and every other country is just following in our footsteps. You see, our healthcare system was designed to deal with acute care. It was never intended to deal with chronic disease. And unfortunately, it's going to cost significantly more to revamp a system than it would be to completely start from scratch. One of the reasons this broken system has remained in place for so long is they've gone to great lengths to ensure that you as practitioners don't understand the business skills necessary to thrive in private practice today.
Unfortunately, the majority of patients in doctors' offices today are there with a mindset and a belief that your job is to manage their disease. And this is where they end up. People are ready. No, people are demanding a change, and there is a movement brewing. Practitioners from all over the globe are coming together and uniting with a common mission and focus is to empower their patients to take control of their health. So how do we take this from the fringe and move it into mainstream? How do we take what's commonly referred to as alternative care and simply make it healthcare?
So you've got to decide. You've got to decide whether you want to be swept up by this movement that is coming, or if you want to own a piece of the change. If this is something you've been wanting, if this is something you've been wishing for, to see this movement happen, then you can't sit on the sideline. You have to get in the game. You have to participate. And we need each and every one of you to unite together so that we can break through this tipping point. I'm Matt Lowman.
I'm Dr. Charles Webb.
And we'd like you to join us and practitioners from all across the globe in truly disrupting healthcare.
You know, we created Freedom Practice Coaching because we saw a desperate need. We chose to arm practitioners with the business skills necessary to not only allow them to survive in their practice, but to thrive in practice. Now, we've become the largest, most successful business coaches in the health field industry, and we've done this primarily through our elite coaching program. Now, this is a very in-depth, high-touch, 3-year curriculum, and it's allowed many physicians to not only become successful in their personal lives, but also helping their patients in a manner that they know is best suited for their patients and their success. Now, we know that this program, although it's been successful, it can be successful for you, we know as an entry point that it is a significant investment of both time and money, and not everyone is ready for that approach when they start. And we also know that even if we're bringing in 100 practitioners, 100 new practitioners every month, we're not moving the needle. Our mission is much larger than that. We're looking to bring in 100,000 practitioners. If we do that, we can literally affect a third of the U.S. population, the patients in the U.S. population. And by doing that, we're now going to hit that tipping point that we're looking for.
So that's why we've created Freedom Practice University. So what we did was we took everything we've been teaching and we distilled it down to 9 core business pillars that without even just one of these pillars in place in your practice, you just can't be successful, let alone thrive. And we've put this into a curriculum that is easy for you to understand, to be able to go and implement immediately, because we want to arm you with those business skills. So look down below, get the details of what's included. If you're passionate about this mission, if you want to own a piece of the change and you want to help us disrupt healthcare, get signed up, get enrolled, spread the word, and let's make it happen.